Hi, welcome back. I'm glad you decided to check back in for the latest updates. Let me start by acknowledging I know there's a lot of concern around personal protective equipment. That is completely understandable, And it's a fast-moving topic, and it's almost changing day by day. Earlier this week, our experts held a town hall forum on the topic. It lasted nearly an hour. All of our experts updated everybody on where we are with lifespan's policies, how we're trying to seek to preserve PPE because we know it is on the top of minds of our frontline workers, as it should be. I would encourage you, if you missed that town hall, go to the COVID-19 website and you'll see a link to it and you can watch it. It's really informative and it's really the latest on how we're approaching this. We're trying to conserve our PPE. We're trying to reuse it when it's appropriate to reuse it. You should know I personally, along with the governor, are working day and night to get new PPE into Lifespan from almost any source, assuming it's a reliable product. There's a lot of products out there that we can't use, and vetting all the products coming from all over the world, it's most important that if we are going to use it, it's something that actually works. So we're working around the clock to make sure that we have enough PPE here for our workers, but it is a bit of a changing policy, and I encourage you, as I said, go see the town hall, go to the COVID-19 website every day because we'll update you on where we are with our PPE. But please know it has been and will be one of my #1 priorities as the CEO of Lifespan to continue to get PPE product in here. Much like the governor, I get asked two very common questions. The first is, how can I help? And I'm really gratified at the number of folks, not only Lifespan, but friends, neighbors, as I'm sure you're having, that really want to help. And they're helping in a variety of ways. So, the state's pulling together, Lifespan's pulling together. So that's incredibly gratifying. The second most common question is obviously, where are we in this pandemic? When will it end? No one knows the answer to that question. However, I would say in the last couple of days, a number of the predictive models, and there are many, and the models differ depending on the assumptions you make and the inputs and the outputs. There's models here in the States, there's models around the country, predictive models trying to answer that question. There seems to be, in the last couple of days, a general consensus building that the peak of this pandemic, at least in Rhode Island, will be sometime in mid to late April. So that says we're still a couple weeks away from where we think the most number of patients may show up at our hospitals will occur. It is not perfect. They change depending on what happens in other parts of the country. But as I've said before, we started preparing for this in January. Now with this beginning to come into focus that we may see the biggest surge of patients in mid to late April, we're getting ready with more ventilators, getting rooms assigned. So we're planning for the surge that is likely coming in mid to late April. As in any crisis, and this is a crisis, communication is absolutely key, both internally and externally. I think we're doing a really good job, as best we can under these circumstances, to make sure we're communicating new information as soon as we know it with all of our frontline workers, all of our staff. We're in daily communication with the Department of Health, the state of Rhode Island, making sure we're communicating with them and they with us. As I mentioned, we're fortunate to have literally some of the world's experts on this crisis right here at Lifespan, and I communicate with them on a daily basis. You can't over-communicate during these crises. It's important that the information we share is as factual as it can be, knowing that we don't always have it 100% right, but we need to really avoid trading in rumors, trying to spread information that we're not sure may be entirely accurate, and we're doing our very best to make sure that that is the case. Again, go if you can daily to the COVID-19 updates here at Lifespan. They are incredibly helpful. There's new information in them every day. We vet the information there to make sure that it is factual, that it is accurate, and that should be one of your primary sources of information during this crisis. Now, more than ever, our care values are so very important. Compassion, accountability, respect, and excellence. I must tell you, I see examples of those daily. when I make rounds, when I go to the floors, when I interact with people. Lifespan folks are truly living our care values, and it's just wonderful to see. I would say the way I'm observing the entire team at Lifespan respond to this crisis is one big care value story. You should be very, very proud. So again, thank you. Thank you for everything you're doing each and every day. You are truly the heroes in this crisis, and I couldn't be more proud of you. But I do want to take a moment to remind us we're early in this crisis. So take a moment to remember that we have families and loved ones, folks who depend on us outside work. Stay in touch with them, socially distant, of course, but stay in touch with them. Life will return to normal. We will get back to having birthdays and weddings and family dinners and going to sporting events and our children's school activities. We will. We will get back to normal. It may not be for a little while, but we will, I promise. But in the meantime, for your own sake and for your loved ones' sake, keep in touch. Keep in touch with them via Skype or FaceTime or a phone call. Keep in touch with them. It's good for them and it's good for your health. Thanks again for tuning in. Please come back next week. Please check out the COVID-19 website on a daily basis. And thank you.